Oli's Therapy Corner. Here on Oli's Therapy Corner, what we try to do is enlighten, educate, inform on all things that are psychological. And if you understand psychology, you understand that it touches every aspect of our lives. So we try to provide educational, enlightening sources for you that will help you in bettering your life. Okay, so today for our Therapy Corner, we have Larisa Traga. Now, I've known Larisa for a number of years here, but I'm going to introduce her, and it's a long introduction because she's a very impressive lady. Larisa Traga is a California licensed clinical social worker, what we call an LCSW. She's a master addiction counselor with a co-occurring disorders specialization. Okay. She provides training, supervision, consultation, and therapy to the Santa Barbara County community and beyond. She is a EMDRIA, which stands for EMDR International Association, approved EMDR certified therapist, consultant and certified trainer of International Network of Trainers for Motivational Interviewing. Two big things going on there, folks, EMDR and MI, and we're going to talk a lot about that. Larisa has been an adjunct psychology and human services instructor at Allen Hancock College since 2015. She has a private practice, and in it she specializes in culturally sensitive individual psychotherapy for all ages, children, adolescents, and adults. And she uses an eclectic approach, which means she pulls in whatever's going to work for the client. And it includes the EMDR, CBT, MI, and mindfulness techniques. Larisa treats a variety of issues. And so she's a very, very talented, very skillful therapist. In addition, Larisa provides high-quality consultation services towards EMDR certification. And finally, Larisa is a trainer and conducts public and private training on evidence-based practices. An amazing woman. So welcome. Hello, Larisa.
Hi, Oli. Thanks for having me back. It's a pleasure to be with you.
Absolutely. I enjoy having people on who are so, I'm going to say, gifted in therapeutic approaches. So today, folks, we're going to talk with Larisa about both EMDR and MI. Now, she spoke about MI last time, but I think it's good to review a little bit. So, Larisa, if you would kind of inform our audience, what is MI? What is motivational interviewing?
Yeah, thanks. So, motivational interviewing is a counseling style that really is helpful in supporting clients through any change that they want to make in their lives by helping them resolve their ambivalence. It's also really strength-based and client-centered. So the client is kind of in charge the whole time, and they're able to have a space where they can reason through all the different things that are keeping them where they are, but also all the different things that are pushing them towards making a change in their life. And so it's an approach that has been found to be very effective with behavior change.
Okay, a couple of things you said I really like because I'm an existentialist, you know. You talked about giving them the space, and basically I'm interpreting, and correct me if I'm wrong, really getting them to see not only their responsibility, but their control over themselves and what they can do.
Yes, it's very empowering, and it really allows the clinician to support their autonomy in whatever decisions they want to make and how they want to go about making a change when they're ready to do so.
Yeah, I think what catches me all the time when I think of MI, motivational interviewing. First off, I remember the first time I heard interviewing, I kind of went, interviewing? This is therapy, not interviewing. But then I got it and I went, wait a minute, motivational interviewing. You're really, I'm going to throw in this, correct me if I'm wrong, you're really throwing in there what you're capable of that you're not seeing, helping you to really see your strengths, to see how you can do the stuff that you feel you need to do. In essence, motivating the person. And you do it through that word, interviewing, which I seem to have a problem with. Interviewing as a way of saying, I'm not telling you what to do. I'm not asking you what to do. I'm asking you to look at what you want to do and then help you motivate in that direction. Does that kind of capture it?
And I think that's a beautiful description of why it's called motivational interviewing. I actually really like that. Yes,
Oh, okay.
it's a guided approach. It's a guided conversation. So the clinician is very intentional in the strategies that they use with, let's say, questioning, affirmations, reflecting, right? To be able to support the client through that journey and getting them to their destination that they choose to go to.
Cool. Okay, so let's shift here because one of the things that I know and you know well is that sometimes we've got some really, really painful parts in our life, experiences that have gotten in our way. And as I say, trauma is defined by ourselves, not by some objective third party. It's something we experience. And so this is where EMDR becomes so important. So talk to us a little bit about EMDR and what that does, how that's different.
Yeah. So EMDR, as you probably know, has been getting a lot of attention in the media in the last couple of years at least. And partially because it is such an effective and powerful approach to treating things like trauma, treating, even now it's been found to be supportive in treating depression and anxiety as well. So, and the great thing about EMDR is that it allows a person to be able to make sense of some of the things that have happened to them in a more adaptive way, um, to where they come to a place where they're able to look at some of those experiences, but not let those experiences continue to trigger them in their present and affect their lives, their relationships, their employment, and things like that, right? So I would say that it's a great addition to our field to be able to use EMDR to support clients through some of those challenging experiences.
Yeah, what comes to mind are a couple of things. One, uh, EMDR I know got a lot of play in the military because of the fact that you had people coming back from truly undeniably traumatic events when they've been deployed in war zones. And they found EMDR to be incredibly effective in helping these folks, these military folks, deal with the trauma that they experienced. Incredibly helpful. So I know the military uses it a lot for folks that have been traumatized. Uh, the other thing that occurs to me is something that I've always told my clients is that you need to understand when you sustained a trauma, whatever it was, whether it was child abuse or a gun stuck to your head, doesn't matter, whatever the trauma was, you don't forget. And the key here is learning to, as you just said, finding a way to look at that, interpret that, work with that, process it to the degree that it doesn't become a problem for you. The memory will always be there. I talk to some of my clients about things that happened to me because I had an abusive father. And I said, I have incredible memories of it, but they don't bother me anymore
Mhm.
because I processed that. And this is where EMDR comes in. So maybe could you share a little bit about what is the process of EMDR? What do you do in quotes in EMDR as opposed to some other therapy?
Yeah. That's a great question. So the way that I practice EMDR is in stages. So we have three stages. The first stage is where we prepare you. Okay, so teaching you different coping skills. And we begin to introduce the bilateral stimulation, which is what has been found to be one way or one reason why it works, is stimulating both your right and your left side of the brain. And so we prepare you by teaching you different techniques and skills so that when we get to the actual EMDR part, you're able to manage the stuff that might come up when we are adding the bilateral stimulation. So we either do it by eye movements with our hand or a light bar, or we might use tapping, so angel hug tapping or butterfly, or tappers. And so once after we prepare you, then we figure out, okay, so what do you believe about yourself as a result of these experiences that you've had in your life? So the cool thing about the way that we practice EMDR is that we don't need to know everything that happened to you. All we need to know really is, what do you believe about yourself as a result of the experiences you've had, right? And then we can pick a few targets from past, present, and future and kind of go at it and do our intervention with the bilateral stimulation to help you get to the other side of it, which is to a place of looking at it, not having it have such an emotional charge, maybe even reducing vividness of some of the experiences. One of the most common feedback I get during processing with clients is, I don't really see it anymore, or it's getting farther and farther away from me, which allows them to feel more relief as a result. And then the final stage is integrating. So whatever progress you made during EMDR stage 2, being able to see how that's integrating into your life. So following up with you, making sure things are going well, and then making those connections of how the progress you've made in the treatment, in the therapy, is now being taken into your life, how you're applying it to your life.
Good. It just occurs to me we might want to back way up and explain to people what EMDR stands for.
Yes. So it's a really long way of, so it stands for eye movement desensitization reprocessing, but short EMDR.
Yeah.
And really, Robert, Francine Shapiro, who is the founder of it, has said years later that she wishes she just called it reprocessing therapy, but it was too late by then. So
Yeah. The reason actually I wanted you to spell it out was because one of the things that you said was the tapping. And this is where you're not doing the eye movement like the original model. There's the new things that we've found, which I'm going to say it's sort of a distracting mode, but it helps to integrate the two sides of the brain.
yes, yes. So we use now tappers or tapping to do that distraction stimulation.
Mhm.
Yeah.
The other thing I wanted to bring out, because I said at the beginning, the trauma is as we experience it. And I flashed on a client that I had this horrible traumatic thing that she talked about and talked about and talked about. Then it turned out, after a few years of therapy, it was what her mother had implanted. She never experienced it, but it became so real to her that she was, in fact, experiencing trauma from this implanted memory. And so this is why I say, it's our experience of trauma. And this is where EMDR, I think, is just fabulous in helping people work that process through so they don't have to keep holding on to this trauma forever and ever and ever.
Yeah.
So
That's
thank you.
actually making me think about a client I had who was reluctant to doing EMDR because she wasn't sure if she made up
Mm-hmm.
that her father molested her,
Mm-hmm.
or if it actually happened to her, because of the reaction from her mom and her sister, who were
Yep.
denying anything like that. And so,
Yeah.
yeah,
Yeah.
and it
I'm more.
doesn't matter.
Yeah, it's like I'm working with a client now who, in some senses, has double trauma. She was molested by, I can't remember, it was some relative. But then she was told she was lying. She was told, no, that's baloney. You can't be saying that stuff. So then she got traumatized by her mother and everybody else telling her no. And so she had the initial trauma of being molested, and then she had the secondary trauma of the disbelief from her family. So you got this double whammy. Anyway, I didn't mean to get off on the whole issue of trauma. We're talking about how to work with it. And EMDR, yes, works really well with it. Okay, so you wanted to talk, I know, about integrating the two, and I was fascinated when I heard that. How do you see these two integrating?
Yeah. So I have just kind of naturally been integrating the two because I happen to be trained in them around the same time. And I thought, hey, this is going to work really well. And it really has. And what the way that I integrate the two is, one thing about EMDR is that a lot of times people will come in and they'll say, I want EMDR, but I'm afraid of it, or I've had an experience and it wasn't so good. And so this is where I find MI and or motivational interviewing can be really helpful because the different skills and strategies that you learn in motivational interviewing allow you to build that therapeutic alliance, that rapport, engage your client in a way that they feel safe enough with you, that then you can go in and work through their trauma. There's something about EMDR that seems, scarier for people than just coming in and talking about the things that have happened to them. And so I have found that helping them through motivational interviewing to, resolve some of that ambivalence about going into the past, right? Or even that we don't have to even start in the past. We can start present or future and then slowly work our way backwards. So motivational interviewing can help with that piece. And then it also is really supportive in that integration part. Because even after we have worked through something with EMDR, there's a need to, it's almost like augment the progress they made in the processing to be able to apply their insights into their lives, right? So, for example, somebody who maybe wants to reduce their substance use, but they realize that they really do want to reduce their substance use because they want to have relationship with family and things like that, but they're having a fear of, let's say, going to meetings because they don't want to be seen and they don't want to be reminded of their failure because it's their 10th time or whatever, right? And so this
Right.
is where motivational interviewing comes in as well to support them through those other barriers and challenges that EMDR can't necessarily get to.
Hmm, beautiful. Yeah, you said some things there that just absolutely intrigued me because we all know that, uh, according to the research, as they say, 75% of the income is based on the relationship that's developed between the therapist and the client. Well, EMDR, we know, is an effective tool for dealing with trauma. But as you say, if people are afraid of it or don't understand it, and that's where the fear is coming from, or hesitant, or maybe they had a bad experience with it, you need to develop a relationship with it before it can work. So the motivational interviewing, as I'm hearing you say, gives people an opportunity to really get motivated through working with you and talking with you and feeling comfortable with you and feeling motivated to do something about those issues that are blocking them. And then you do the EMDR. But then you said the other thing that I really like. After the EMDR, you can use the MI to help integrate all that they've learned and experienced and worked through so that they can just, I'm going to say, walk away a better person, a person that's achieved a certain degree of growth and resolution in their life and gotten to where they want to go, free of whatever trauma was hampering them.
Yes, that's a really nice summary of
Hmm.
how I integrate the two
Yeah.
and why. I do it.
Yeah, no, that makes perfect sense. I'll share with you. As I said, I was an existentialist. I was trained in humanistic existential psychotherapy. Spent 2 years in graduate school learning this stuff. And on the day we graduated, they turned to us and said, "Oh, by the way, you'll be eclectic." Huh? What the hell did we spend 2 years learning humanistic existential psychotherapy for? And they said one really important thing, which you're talking about. One size doesn't fit all. But what you're doing is amazing, I think, because you're taking the motivational interviewing, and it's an eclectic approach because you're using more than one modality. You're taking the motivational interview to gather the person in, feel trust, and recognize where they want to go, using the EMDR to, I'm going to use the word cure, which isn't fair, but cure, and then finally going back to the MI to help integrate that stuff. Holy cow. Perfect use of eclectic therapies.
Yes. And, I sprinkle in mindfulness and CBT in there, but those are my go-tos in terms of being able to engage, keep the client in therapy long enough that they'll see benefits from it.
Mm-hmm.
And in essence, help them be able to leave therapy feeling empowered to go on their own. There's just one thing that I thought when you told me about the audience, I figured it might be helpful to maybe talk a little bit about when someone is looking for a therapist,
Yes.
what they might consider doing, right? So if they're looking for a therapist, I think there's some tips that I'd like to give of, contacting whoever based on, I don't know, insurance or their limitations or whatever. And when they're contacting them, to request a 10-15 minute consultation where they can ask them questions like, what do you specialize in? How do you work with, let's say, childhood trauma versus adult trauma? Do you do anything different when you work on past trauma? Like I said, I prepare you before we jump in, to the EMDR processing, right? And then also, if someone is highly sensitive, which is something that's also getting a lot of traction right now, that you ask, do you work with highly sensitive people? How do you work with highly sensitive people? Because a lot of people, I think about 80% of people who seek therapy are highly sensitive. And so if you're one of them, making sure that your therapist is able to work with you and understands what it takes to guide you through that process. So those are just some things that I was thinking about. I don't know what else.
We've talked about some of your approaches, the MI and the EMDR, and being eclectic and bringing it together. And I mentioned, making that connection and all that. But you're pointing out some really, really important things, which are ask questions. What are you looking for? And I give you a really terrible example that happened to me. I had a gentleman who wanted Jungian therapy, and I said, I don't do Jungian therapy. And he says, well, okay, I'm willing to work with you because you're on my insurance panel. Oh, okay. So you're going to work with me just because the insurance will pay for it. Got it. All right. So we started to work, and, it was about 3 sessions into it. And he started saying, well, what would be the Jungian approach to this? And I said, remember, I'm not a Jungian. I said, existential, yes. Jungian, no. And finally, we had to terminate because he was really, really hung up on this Jungian approach. Well, he should have found a Jungian therapist.
Yes.
I'm not. And I was trying to serve him as best I could, but he was stuck on this idea of having a Jungian therapist. Well, we're not going to get anywhere. So, ask those questions. What kind of therapy do you do? Are you able to work with, generalized anxiety disorder, major depressive disorder, schizophrenia, what do you work with? And it's so important to ask those questions, and not all therapists treat all things. Like I said, I don't do Jungian therapy.
And not all of us specialize in the same things. And
no, exactly.
we all have different approaches. And I think the other piece about it is that when you take the time to kind of interview your potential therapist,
Mhm.
you feel more empowered to then decide who do you want to go with, which is
Exactly.
very helpful. And also recognizing that, like, okay, well, I tried and it didn't work, and that's okay too. I
Yeah.
can try somebody else.
Yeah. No, and yeah, I was thinking as you said that, I was thinking of a gentleman I'll never forget. He was just, I was working along with him. It was like our fourth or fifth session. And then he finally says to me, you know what? This isn't working. I was shocked. And I said, oh, okay. And he says, yeah, I was trying to make it work, but I just can't seem to connect with you. And I said, no problem. Because one of the things I say at the very beginning of every therapy session is, or new client session, hey, the the relationship's important. If you're not connecting with me, for God's sakes, let me know, and I'll pass
Mhm.
you on to somebody else because that's not good for you. You got to make that connection. It's really, really important. And so I'm glad you brought up this thing about asking questions because, yeah, don't be hooking up with a therapist that can't give you what you need.
Yeah, especially with EMDR, I think it's important that you are with someone that you feel safe with and that you can trust because of how deep it can go in terms of working on past trauma. So
Yeah,
yeah.
I'm glad you said that, circling back to the EMDR thing, because, yeah, you are going to be dealing with trauma. And trauma's, well, hell, it's a painful thing. Hello. It's not something we go to gladly. Oh, here, give me some trauma. No, it's a painful experience. And do we really want to relive that with anybody? So you've got to, and I'm glad you said that, feel safe. Yes, you have to feel safe with the therapist because, yeah, we're going down that road, but going down that road together, you know?
Yeah, together. And the one piece I don't know that I mentioned is that EMDR is really different from any other therapy in that we don't have to talk about it. We don't have to relive it in that way. We can process it and let your brain sort it all out because the brain is the expert, we say, and get to the other side of it. So in that way, it makes it easier, and the relationship is still really important in that process.
Yeah, I'm glad you said that about the EMDR not having to go down that because I think that is a misconception that a lot of people have about EMDR. I remember early on, people would say, "Oh, you sit there and you do this eye movement thing, and then what you do is you talk about the trauma." No,
You don't.
that's not what you do.
Yeah.
It's kind of magical what you do, but
Yes, it is, but I can't say that.
yeah. Carry on the good work.
Thank you. Thanks for giving me the space to have this conversation with you and to share some of what I do and my passion for it.
Absolutely. Thank you. Okay, take care.
Take care. Bye-bye.
All right.
Bye.
Okay, well, thank you again for joining us here on Oli's Therapy Corner. I hope you enjoyed today's segment, and I hope you learned something from it. EMDR and MI are incredible tools to help you to be the best person you can be. And again, I hope you can remember some of the things that Larisa said in terms of connecting with a therapist. Ask questions. Don't be afraid to ask questions. It's really important that when you seek therapy, you connect with a therapist you can work with. It's really, really important. Okay. So, listen, you guys out there in the world, have a great life. And if you need a therapist, look one up. Take care.